Now, once we have an introduction towards the HIV, that is the human immune deficiency virus, and we've gone through the major symptomatologies or the clinical presentations that we usually encountered in a patient of AIDS, that is the acquired immune deficiency syndrome, we have enough knowledge just to know that the major problem or the major pathology is with the CD4 cells, or the counts of the CD4 cells is the major pathology that we have in such patients. Now, what is the functioning of these CD4 cells? Why are they present in their bodily symptoms? The major function is in the defense mechanisms or in the immune systems of the body. That is basically the white cells of the body that are providing the immune systems or the immunologies towards the different infectious states that are present in our environment. So having a CD4 count level below the normal levels is basically making the person more prone to the contraction of the infections. Even the slightest infections that are present in the environment can prove to be fatal for such person, because such a person cannot basically fight back such infectious state. Usually the ailment criteria is quite difficult for such person. So this is basically the highlight, or in a layman terminology we can explain it to be the pathogenesis of the AIDS, that is the acquired immune deficiency syndrome that we're talking about over here. In this section primarily we'll be giving you an overview towards the underlying pathogenesis of this acquired immune deficiency syndrome. What is the normal mechanisms that are usually being carried out in our body, and what basically happens in a person who has contracted HIV or who has developed AIDS after the contraction of HIV, and how is it basically going to affect his daily life routines, his daily life defensive mechanisms. How are they being effective due to an abnormal CD4 level functioning in the body over here. So we'll be discussing the early entry. First of all, what happens after the HIV enters the blood, and then we'll be discussing the pathologies or the underlying pathogenetic behaviors in such mechanisms, and then we'll be discussing the clinical manifestations along with this underlying pathology. So that is basically the main crux of this section over here that we are discussing right now. When we talk about the early entry, we are basically talking about a stage where the CD4 levels are more than 500, they are between 400 to 500 per cubic millimeters. Usually the person is asymptomatic in such a stage. So this is basically the early entry that we are talking about. It's basically confirmed by the intrathecal antibody synthesis. This is basically a confirmatory test that is being carried out for the early stages of the disease, or when you suspect a person to be suffering from the HIV, or he gives you basically a history towards sexual contact with a person of HIV, and you're screening that person out and you just find out that he's basically in the early phase of the disease. That is basically the test for the confirmation. The virus is often retrieved from the CSF, that is the cerebrospinal fluid. So usually the procedure that is carried out is the lumbar puncture at the level of L5 that is carried out in these patients for the confirmation, or for carrying out this intrathecal antibody synthesis in these patients. Probably ubiquitous in such patients as well. Now, when we talk about the pathogenesis of the underlying mechanism that is taking place in the patients of the HIV or in the patients of the acquired immunodeficiency syndrome, what basically happens over here is that, as you can see over here, we have these latent virus that is residing inside the CD4 T cells over here, and on the other hand, we have the natural killer cells. So usually the defense mechanisms are allayed when we have an activated natural killer cell, and on the other hand we have an activated CD4 T cell over here. The enzymes usually involved in this process are the GS9620, and over here again we have the G69620 over here as well, the viral proteins, and we have the receptors on the natural killer cells over here. And usually this has to be a successful activation of natural killer killer cells and the activated CD4 T cells over here. But when you have a virus that is residing inside the T cells, usually the cell death occurs, and this mechanism is not successful in patients of HIV or in patients who have the acquired immune deficiency syndrome in a full-blown manner or in an early stages as well. Now, basically, the infection of the non-neuronal cells is quite important over here, and that is basically making the highlights over here. That is, the infection activates the CNS macrophages even over here. The activated macrophages produce the toxic products, and that is basically going to inculcate the immune system, or the defense mechanisms are activated after the activated macrophages produce the toxic substances. The viral products may be neurotoxic even, and that is why basically they can form a biochemical imbalances, and these biochemical imbalances basically indirectly produce the neuropsychiatric complications in the patient as well over here. So the pathogenesis, when we talk about them, it's basically the HIV activates the macrophages first of all, and then the macrophages produce the TNF and the IL-1, that is basically the interleukin-1 and the tumor necrosis factor that is being produced by the macrophages, and that leads to the stimulation of the T lymphocytes if they are not residing the HIV or the human immune deficiency virus in the nuclei. So that is basically the underlying pathogenesis over here when we talk about the people who have the acquired immune deficiency syndrome within them. The key points over here are the other viruses can infect the neurons as well. For example, the herpes and the rabies virus are most notorious for this. These produce the irreversible deficits. The HIV produces the combination of the reversible and the irreversible deficits in the patients as well. The pathogenesis that we can talk about over here is the cortical thinning on the lateral brain surface in the HIV and the AIDS patients. So when we talk about the delirium, the dementia, the personality changes even that are being produced as a complication or the neuropsychiatric complication of the patients of HIV and AIDS, one of the reasons can be the cortical thinning or the lateral brain surfaces in such patients, which is quite frequently noticed out. The right hemisphere is on the left, and the mean cortical thickening for the matched healthy controls. So basically we have the healthy controls on the right, and we have the patient's right hemisphere on the left. For comparison, the average percentage thinning of the cortex in the AIDS relative to the healthy controls. So there is basically comparison or the comparative study that was being carried out between the healthy patients and the patients of the AIDS or the HIV. The reds basically indicate the significant cortical thinning in such patients. So maybe this cortical thinning is the cause for the development of those personality changes, the deliriums, the dementias, the loss of the memory in such patients who have contracted HIV or who have developed AIDS, that is the acquired immune deficiency syndrome. So basically in this section, we summarize the symptomatologies or the neuropsychiatric complications and what is the underlying pathology for the development of such complications. So that is the end of this section. Thank you for watching sqadia.com.